All right, so healthcare agencies. This is chapter 1 in your CNA textbook. I do not ever mind if you are working in your textbook as I am lecturing. Okay, I do not mind that. It does not bother me. But I will potentially ask you to interact with me. I hope more than I'm talking, honestly. So I have also told you before that I don't really like reading objectives because then I just want to talk about it and get into it as well. So I'm not going to go over every single one of those. There's 8 objectives there to get started. Excuse me. In all of these lectures, it is going to say the person instead of the patient. Drives me nuts and bananas, okay? But it's how our book is. It's how everything is with CNA. And so it'll say the person. So you might hear me interchange the term patient and person because up on the lecture or whatever it is or the test question, it might say the person. So the person or the patient is always the focus of care. Healthcare agencies must follow local, state, and even federal laws and rules, and that ensures safe care. So think about COVID. More than anything, our state wasn't so COVID scared, right? But federally, we had to follow their rules. Okay, we had to follow the federal government's rules with COVID. That's just one example. There's so many things federal rules can power ours and so forth. Okay, staff members have special talents, knowledge, and skills, but all work to meet the same patient's needs. With the goal to make the patient better or to support their everyday lifestyle. Agency purposes. So this is the healthcare agency. The title of the chapter here. So the purpose of healthcare is to promote health, to support it, to promote it, also disease prevention. Next is going to be the detection of treatment and disease. So this is going to be like running tests, doing exams, and so forth. Rehabilitation and restorative care is going to be the last one. So health promotion is going to be like, here's this food triangle. We really need you to eat this many vegetables, this many fruits, and so forth. Also exercise, and then how to cope with health problems as well. What does Ms. Straube tell you? You need to make sure and get rest. Take care of yourself. I know it's your senior year. You want to have fun. But that's when you're going to break down and you're going to get sick, right? And we don't like that because we want to really have the full you here and so forth. But we do understand Ms. Straube gets sick just as well as you guys do. So disease prevention, we work on that specifically with our patients and ourselves in this program because we have to get immunized. So polio, measles, mumps, smallpox, hepatitis B. And then in another example of promoting health or disease prevention would be promoting healthy habits to prevent blood pressure to be raised or to prevent of being obese or overweight. So, and then I told you the detection, the treatment of disease is going to be diagnostic tests, physical exams, x-rays, labs, and so forth, okay? Rehabilitation or restorative care, those are going to be things like physical therapy, speech therapy, maybe for a stroke patient, occupational therapy to get the patient back to their work or job, and just to restore their most highest and possible level of function physically and mentally, okay? Many different agencies, though, are going to be a learning site for students. The students assist in the purposes of healthcare. So the different types of agencies include hospitals, rehabilitation and subacute care agencies, long-term care centers. Those are also called nursing homes, but we really need to try to call them long-term care center. Assisted living residencies, mental health centers, home care agencies, and then hospice. Does anyone know what hospice is? Hospice. I'm going to let Bree tell me she had her hand up. You guys had some good answers, but I didn't hear it all. Yeah, so it's usually kind of clearly defined as 6 months or so that you have left in your life. But there's some other kind of standards that meet you to qualify for hospice as well. Some of the patients have a few days to live. Some of the patients do have 6 months or a year to live, but they have some kind of terminal illness or some kind of problem going on that near life is going to be happening. And so the hospice agencies have kind of some different rules with medications. They can kind of supersede those guidelines, okay? They have a lot of counseling and support services with them as well. Anything that you need near the end of life to support you and to give you less pain and more comfort care. Home care agencies are going to be like if you have a nurse come into your home and help you do some dressing changes or do therapy with you as well, or anything like that. So that's not necessarily just hospice that can be covered in your home. We are going to spend the majority of our time at clinical and long-term care centers and hospitals. We're going to split it pretty evenly. So hospitals and long-term care centers. This is what a pretty typical hospital room setup is going to look like. You can see that there's red outlets on the wall. Red probably means what? The color red in a hospital probably means what? The color red. You said emergency, right? So guess what? Red outlets in a hospital or a nursing home or something like that, federal law say are outlets that can provide power that are hooked up to a generator. Those outlets all have to be red, okay? So if we have a ventilator and a bed hooked up in a room, a bed that, up, down, stuff like that, which one of those is going to be a priority that it's working when we don't have power? A ventilator. A ventilator is something that breathes for a person, okay? So we can unplug that bed for a little bit if we have that in a red outlet and get that ventilator hooked in if we need to switch them. But most of the time we're going to just go ahead from the beginning and hook in only ventilators to red outlets because that means they have power to them at all times, even through a generator and so forth. So the thing over top of the bed there is called a bedside table. You'll see that sometimes I use one in my classroom quite a bit to just put things on. We have those in the lab. The hospital bed itself, a chair for the patient and also the guest to sit in, a computer to chart, and so forth. This kind of looks more like an emergency room, if I was being truly honest with you, set up than necessarily like a hospital room. So this talks about the different healthcare agencies again in pictures. So you could start off with the hospital, be it home care, the ambulance, so emergency services, hospice, medical companies, nursing, long-term nursing centers, and then also the doctor's office as well, which I hope that's the only thing that you really have to experience is going to be those doctor offices. The organization of healthcare, there are different agencies that govern, like called Board of Trustees, Board of Directors, and so forth. You have those at your school, but we also have those in healthcare facilities too. So the board at whatever facility is, they make the policies, okay? There should be an administrator to manage those policies that the board put into place. And then underneath that, there should be directors or managers or department heads that kind of manage certain areas, okay? Long-term care is usually owned by an individual or a corporation. Some are owned by the county, state, and health departments, but the majority of them are privately owned or a corporation that is really big. There are also some government-owned facilities, and think of like the VA. Do you guys know what VA stands for? Like the veterans places. So there's long-term care centers that are owned by the Department of Veteran Affairs, and also hospitals. Okay, there's a VA hospital in St. Louis, Springfield, Kansas City, and Columbia in the state of Missouri. And veterans have free medical care for the most part at those facilities. So long-term care facilities, there's not a lot of them, but there's some for veterans only. It's also, again, it's free to them, but guess what? Their waiting lists are so long to get into those facilities, not all of the veterans end up getting to get into them. But it's super, super nice. The healthcare team involves many different types of healthcare workers. So not just a nurse or not just a doctor. But they all come with skills and knowledge to focus on the patient's total care. The goal all the time is to provide the patient with the most high quality care, and then the patient is always the focus. My biggest thing in life in just this year for you, whether it's an animal or a human, my biggest personal thing for you is that you need to treat every single patient, whether they smell, they're in prison, and they're shackled to the bed, or whatever it may be. Okay, or it's this sweet old grandma over here that we're even calling grandma, even though she's not ours. We need to treat them all the same. My policy in my own head is that I treat them as if they are my own grandparent or parent. Does that make sense? Even if I'm not happy with them sometimes, I still would want the best care for my own family member. So every single patient, whether they smell really, really bad, okay, or they're super sweet, we need to treat exactly the same. They are the reason why we're there. Yeah.
Just for like the future or whatever.
Yeah.
These little diagrams, left and right, is it?
Yeah, so you need to use anatomical position. She has a good question about the A&P book. You need to do anatomical position. So when it's on the book there, right is going to be
The opposite.
of yours.
Yeah.
Yeah.
Okay.
So I would go ahead and mark it on your book.
Okay.
I think you're ready to crop it.
So you're facing like this.
Mhm.
Okay.
Yeah. I kind of have to do that too. Does that make sense? Like put myself in anatomical position. Remember, feet forward, thumbs out, so forth. All right. Nursing services, so some terms to kind of familiarize with self. So there's the director of nursing, and often we like to use abbreviations, okay? So some of these may be abbreviations that are also on your terminology, your first quarter terminology. DON. DON stands for Director of Nursing. The Director of Nursing is pretty much always going to be a registered nurse, and they are responsible for all the nursing staff in that facility, okay? So responsible for a lot of people. Nurse managers then assist the director of nursing, and then usually nursing areas have a charge nurse every single shift, depending on how long that shift is, what their shifts are, and so forth. Staff nurses are going to report to the charge nurse. LPNs are going to report to the staff RNs or to the charge nurse. And then you, as a CNA, because that's what we're talking about, you as a CNA, you are going to report to the nurse that's supervising your work. So, nursing education is also a part of nursing services as well, or staff development. Every single year since I've been a nurse, I have to learn new things about nursing and so forth, and we have to continually do what? CPR every 2 years, TB testing, and kind of learn new things every year to keep up to date on our skills as well. The healthcare team. So, the healthcare team is going to be an interdisciplinary team. It's those who provide the nursing care. So we're going to start off with a registered nurse. A registered nurse, you can either get a 2-year or 4-year degree. Okay, 2-year or 4-year degree. A 2-year registered nurse went to school for 2 years and got an associate's degree. A 4-year registered nurse obtained a bachelor's degree, and they're still an RN. Whether you're an RN in either one of those categories, associates or bachelors, you still take the same end exam for the state, which is called the NCLEX. Okay, the NCLEX. So within the registered nurses, what they do, they assess the patient, they make nursing diagnosis, they plan and implement care, they can delegate things to do to the CNA and the LPN, and so forth. Okay, LPNs are licensed practical nurses. Typically are in programs from 10 to 18 months. Our program here at Pike Lincoln Tech is an 11-month program. It used to be 12 months when I started here. It's an 11-month program that they graduate with their LPN after 11 months, and then they go set for their state exam, which is also called the NCLEX, but it's for LPNs. So they also have an end exam. But they do take on fewer responsibilities than an RN. An LPN, a big difference in an LPN and an RN is that an LPN can't start blood products through an IV. Okay, once the blood is going for 15 minutes, then an LPN can take over. Other things are typical in scenarios. RNs are going to be in charge over an LPN. Also, the major narcotics, an LPN might not be able to push that facility or something like that, okay? But let me tell you something. I trust a 20-year LPN all day long, or a 5-year LPN over a new grad of, I don't care if they have a master's degree, okay? So I don't try to downplay anybody, like the janitor or the CEO. To me, they're on the same playing field. Does that make sense? So as I'm telling you these branches, kind of just think less schooling. So us too, we're CNAs, we're here. We really just have to get, honestly, 100 clinical hours and 75 classroom hours. If we had more time here, then we could get this done even faster, right? So it kind of starts out at the branches of nursing as CNA, LPN, RN associate's degree, RN bachelor's degree, and then nurse practitioner, and so forth, okay? So this is kind of that, exactly what I've been talking to you about the past two slides, but kind of like a diagram. Also, it talks about other people within the hospital. So the hospitals and nursing homes, whatever they are, they all have these board of trustees or administrators as well. But they also need housekeeping. They need purchasing. They need a business office. They need payroll to pay their staff. They need admitting the patient. They need laundry, right? They need clerical skills. They need public relations like marketing. They need the nurses, of course, that we just got done talking about. They need doctors, right? But they also need staff that can do x-rays, lab, respiratory therapy, physical therapy, social services. What's social services?
For the kids.
What?
For the kids.
For the kids? It's for everybody.
I would say like volunteer and like some of the
Okay, kind of can be. The social services think more than anything, think they're the ones who are making sure that you come in as a patient, you come in homeless, that maybe they're going to line you up with someplace to go, okay? More like counselors in some ways. Social services, they kind of concentrate more on lifestyle, the patient, what they can do to assist them, are their religious values being met, and so forth like that, okay? Occupational therapy, speech therapy, pharmacy, and spiritual care as well. Spiritual is going to be supporting whatever the religious area is going to be. Nursing care patterns, okay? So these are the different types of nursing care patterns. The first one here that we're going to talk about is going to be functional nursing. This involves focuses on tasks and jobs, and this is where CNAs are going to give baths, make beds, and serve meals to the patient. In team nursing, it is involved a team of nursing staff led by an RN, and then you kind of pick around and do, the RN delegates what you're going to do, but the RN could also be the one that does the bed bath instead of the CNA if the CNA has too many other things going on, okay? Case management is kind of like primary nursing, where it involves total patient care, works with doctors, the health team, insurance companies, and community agencies as well. Then lastly, there's patient-focused care, and we should be patient-focused care the whole time because that's the reason why we're there, okay? This is when services are moved from departments to the bedside. So the nurse draws the blood instead of the lab because she's in there for other things. Does that make sense? And then it decreases cost and maybe sticks for the patient as well. This is a diagram from your book that talks about the slide I just talked about. So this is going to be a picture straight from your book. Paying for health care. Whew. All right. I'm sure your parents complain about this. One of the ways of paying for health care is private insurance, okay? Even though I get my insurance through an employer, okay, Pike Lincoln Technical Center, that's still considered private insurance. They pay my private insurance premium. They pay for it, but it's bought by individuals and families. Group insurance, that's more of actually what workplaces do. They buy a group plan and then everyone is under it. But that's going to benefit more like organizations or groups as well. Medicare. You need to know the difference in between Medicare and Medicaid. Does anyone know right now? Medicare and Medicaid. Okay, thank you, Reagan.
Medicaid is for the non-elderly. Medicare is for
Thank you. So here's my way of remembering it. I'm not sure if you've heard this before. Medicare, think care of the elderly. Okay, care of the elderly. Medicaid is for children, and then anyone with stage 4 renal disease, that's kind of like a random one in there. Stage 4 renal disease, and then children. Okay, so Medicaid is also state funded, where Medicare, that's what you get when you're 65. So when you're older, yeah, or disabled. Thank you. So think about the elderly too. That is paid for by the federal government, okay? Where Medicaid is state-provided health care for children, and then renal disease and so forth, okay? Those are going to be the big differences in between Medicare and Medicaid. In 2010, they put in the Affordable Care Act for insurances. Obamacare is another name for it. It was where you're going to buy insurance through this health insurance exchange. it's went away, but it hasn't. There's like a marketplace, it's called, online, and you kind of shop for different health insurances depending on how much you can pay, or depending. Did it change things? It did a lot in a lot of significant ways as far as like some of the care we can provide. But honestly, it didn't in the same thing, because when you bought private insurance before, you were basically getting what you paid for then too. Does that make sense? So, I'm not quite sure, but it's kind of going out the window a little bit now, but still there a little bit. So, the prospective payment systems, they limit the amount paid by the insurance, Medicare and Medicaid. So guess what? Guess who controls our medical bills, really? Guess who controls it? The hospital can charge whatever they want. But the insurance companies, Medicare and Medicaid, and then insurance companies, they tell them how much they're going to pay. Okay? So hospitals can charge $16,000 for something, but that doesn't mean that they're not only going to just get like $1,000. Okay? So these insurance companies put these patients into what's called these diagnosis-related groups. So Colton goes in for strep throat. Okay? And it's a pretty simple case of strep throat. He goes to a walk-in somewhere, okay? Gets treated with some antibiotic, gets a strep test, leaves there, goes to the pharmacy, gets some antibiotic, and goes home. He's better, okay? But here comes another patient in. They have strep throat, but they run like 3 or 4 tests because it's not really clear on strep throat. Then maybe they have an ear infection too, and then maybe they got something else going on. Guess what? Well, this diagnosis-related groups makes it where the hospital or the clinic, whatever it is, they only get paid for that first thing, that strep throat test, and that medicine, and that's it. Because the insurance companies built these diagnosis-related groups, and it makes it helpful, but it doesn't. So then, even though they do that other stuff for you because they're trying to look at different things, they're really only getting paid for that one first initial thing. Okay? There are also resource utilization groups for payments. There are case mix groups, and then there are home health resource groups as well for insurance. Managed care with healthcare delivery and payment. What this means is they have the choice of where to go for healthcare and the care that the doctors provide. So managed care, the patient has the choice of where to go for their healthcare and the care that their doctors provide. Managed care, though, they like a pre-approval for services. Many insurance companies must approve the need for healthcare services first before they're going to pay for it or before the procedure is done, unless it's an emergency. Okay. Standards, all these standards are set by federal and state governments, accrediting agencies, and so forth. The agency must meet standards of licensure, certification, and accreditation. So licensure is a state license required to operate and provide care. Certification is where they're required to receive Medicaid and Medicare funds. And then accreditation, this is voluntary. They don't have to have accreditation. But say like some of the places we go to, I think like Mercy in Troy, I think they're a stroke care accredited hospital. Does that make sense? And so they get these extra accreditations to kind of look good to the public, and that's great because they're having to make some extra steps to do that. Okay? So accreditation is voluntary, but it signals quality and excellence in that specific area. Surveys. You guys ever got a text, your parents get on text these surveys after we leave the doctor now? It's like, how was your care? Rate us. Well, guess what? The government says these surveys have to be sent out, and then that's how they're going to pay the hospitals or places, which is so weird because somebody could have been they were having a bad day. They had to go to the hospital, right? So do you expect them a person just got mediocre services, guess what they're going to rate you on the survey? A 0 or 1 even. They're going to take it even worse because they've had the worst day of their life. They've had to go to the emergency room. They're stressed. Okay, even though they got mediocre services, they're not going to give them a 5. They're going to give them a 0 or 1. I'm not kidding you. And so the surveys just have not been working that well either. But this is kind of what it comes down to, and this is how agencies are getting paid now. The agencies, as in the nursing homes, the hospitals, the clinics, and so forth. So when deficiencies or problems are found at these LD, like long-term care facilities, the hospitals, so forth, the agency then is given time to correct them. They have to put a plan in place immediately while the agency is there. Then they have to They can be fined with money fine or uncorrected or serious deficiency. And they can also, if they continue on, they can lose their license, certification, and accreditation, all of them, and be potentially shut down, not set down. They would love that. All right, this is probably the end of this lecture of chapter 1. I know we have 2 or 3 left, but we're probably going to end up having to stop here because it's almost time for Troy to leave. But anyways, problem solving. No, let's go here. No, that's fine. Problem solving. So at the end of every chapter, there's going to be a thing that says problem solving. And so it's kind of like a case scenario, okay, for the situation. The nurse supervising you has not returned from a meal break. So when I say you, I mean you as a CNA, okay? So the nurse that's been supervising you has not returned from their lunch break yet. You have a question about a patient's care. Looking at the chain of command, what should you do? So you can't find the nurse that's been kind of telling you what to do, or the other CNA that's been telling you what to do. And you really have a question about what to do for this patient. You have a question about them. Maybe, hey, do they have to have this done before their shower? You just keep on waiting. Who else could you go to? Who else should you go to? You don't have to be correct on these. Yeah, so if there's another nurse or another CNA in the area, they're probably covering that lunch break for that nurse. Okay, so you should ask them or just go up the chain. So like LPN, then RN, and so forth. Okay, but you don't need to go talk to the director of nursing because honestly, they probably really don't know what's going on with that patient. Does that make sense? So yeah, just go around, find another nurse, and so forth. Okay, so this is the end. This is the end of chapter 1. Potentially tomorrow, I may finish up